Welcome to medical students. Today is our topic about ulcerative colitis. So let's discuss what is ulcerative colitis. Ulcerative colitis is an inflammatory bowel disease characterized by chronic mucosal inflammation of the colon and cecum. Okay, so what does it mean? Let me tell you. Actually, we have the large intestine. All right, so the large intestine. Let's suppose this is the large intestine. All right, and this ulcerative colitis is usually arising from the distal colon. Do you really understand? Mean the rectum, mean the sigmoid colon. So this is arising, and this is the inflammatory mucosa. But what it do, it involve all the length. Okay, so throughout the length, it can involve the don't skip any lesion. All right, so it is inflame all the mucosa. All right, it is inflaming all the mucosa. Now throughout the length, it can come to here, it can come to here, it can come up to the small intestine. Do you really understand? So ulcerative colitis is the inflammatory mucosa throughout the layer, right? We have the four layer. Okay, we have the four layer of the GIT, right? So mucosa, submucosa, and muscularis and serosa. All right, so now this ulcerative colitis is inflammation of the two layer. Do you really understand? Inflammation of the two layer. Now what are the inflammation of the two layer? What are the layers? Mucosa and submucosa. Now let me tell you, there are the differential diagnosis. Actually, one is the Crohn, one is the ulcerative colitis. Do you really understand? What is the Crohn and one is the ulcerative colitis. Now Crohn disease is a skip lesion disease. Do you really understand? Crohn disease is a skip lesion disease, and it involving all four layer, mean the transmural disease. Do you really understand? So all four layer. Okay, so all four layer. In ulcerative colitis, it is not involving the all four layer, it is just involving the two layers. All right, it is just involving the two layer, and it is all lesion involving. Okay, so it is all the mucosa is involving, and here is the skip lesion. Do you really understand? Here is a symptom include bloody diarrhea, abdominal pain, fever will be there. Laboratory finding will show you what will increase the inflammatory marker. Of course, it is an inflammatory disease, so inflammatory marker will increase. And the presence of P ANCA. You know that we have the two ANCA, right? So ANCA mean that anti-neutrophilic cytoplasmic antibody. Do you really understand? Now we have the two ANCA. One is C ANCA, or one is C ANCA, and one is P ANCA. So in the ulcerative colitis, the ANCA is which type? The ANCA is the P ANCA type. Okay, so perinuclear ANCA. If you see the P ANCA in the laboratory test, if you see the inflammatory marker increase, what are the inflammatory marker? We will discuss just in a while. Okay, so definitive diagnosis required biopsies. You take the biopsy and then you show if you see any abnormal colonic mucosa and characterize histopathology. All right, so you must know it is a ulcerative colitis. Now what is the other terminology you need to know? This is mostly involving the distal colitis. You know, right? Because it is arising from the distal colon, mean your rectum, your sigmoid colon will be inflamed. Okay, so all the mucosa will be starting from the distal part. Okay, and some drugs you can administer topically to treat this. So that is via enema. Okay, and most proximal inflammation requires systemic inflammation. All right, so protolectomy you can do for the curative. Okay, in indicated for the complicated UC or dysplasia. UC mean ulcerative colitis. All right, now let me tell you. All right, so this is the laboratory test. Okay, so laboratory test, see the ESR will be increased, C-reactive protein will be increased. All right, C-reactive protein will be increased, and leukocytosis will be there. Anemia will be there. Why anemia will be there? Because it is a bleeding type. Okay, so bleeding diarrhea, so you were bleeding inside, right? So that's why you have the anemia. So that's why the patient will have the anemia. Now thrombocytosis, okay, so thrombocytosis, in some cases there can be thrombocytosis, so p-ANCA will be there, and in some cases there will be gamma glutamyl transferase. So you do the endoscopy and you can see the gross pathology over there. All right, so now look, the imaging detecting complications, okay, so you you do the imaging and you see and you look for the complications. If you found any complication over there related to ulcerative colitis, so it will be okay, and it will be easy to diagnose it. Okay, so radiography, so plain radiography, so what will be there? There will be loss of colonic hysteria. Let me tell you what does it mean. Actually our colon do have some hastration, do you really understand? But in ulcerative colitis, this hastration will be replaced by the lead pipe appearance. Okay, so lead pipe appearance. Now do you see any hastration in this case? No, we lost the hastration in the ulcerative colitis. And other finding will be pseudopolyps, maybe there will be false polyps. All right, now let's see inflammatory bowel disease. There are two types. Okay, so one is a chronic Crohn disease, another is ulcerative colitis. Now see, ulcerative colitis is mostly starting from the distal part, and it is involving your all mucosa, your all large intestine. Do you really understand? But Crohn disease is a skip lesion, but what it do, it is involving all the four layer. Okay, it is involving all the four layers. So if somebody tell you ulcerative colitis is arising from where, so you have to tell them ulcerative colitis is starting from the distal, and the Crohn is mostly starting from the proximal. Now the Crohn is a skip lesion and involving transmural, mean all four layer, and ulcerative colitis is not a skip lesion, it is continuous lesion, and it is not involving the four layer, it is just involving the two layers. All right, and that is the difference between the ulcerative colitis and Crohn disease, and later we will see the other difference. Mostly ulcerative colitis have the more chances to cause the colon cancer. Crohn disease have less chances to cause the colon cancer. Do you really understand? So this ulcerative colitis, if you don't treat on time, it will change into the colonic cancer. Now this is the difference between the Crohn disease and ulcerative colitis. So look, site of origin. Site of origin is the terminal ileum, and here is the rectum. You know that the distal part. Then progression, this is the skip or irregular lesion. Here is the proximal continuous lesion. Thickness of inflammation, it is a transmural. Transmural mean that the Crohn disease is involving all four layer, and here is the submucosa and mucosa only. Here will be the symptom, crampy abdominal pain. Here will be the bloody diarrhea and ulcerative colitis. Complication will be fistula, abscess, obstruction, hemorrhage, and radiographic finding. You will see there will be strain sign on barium X-ray, and here will be a lead piping on lead pipe colon and barium. Already you know what is the lead piping, and later we will see an X-ray. All right, so risk of colon cancer will be slight increase, and here will be marked increase. All right, and surgery, here is the surgery such as for complications such as stricture wear, and here will be curative. The surgery will be for the cure. Okay, now let me tell you, here you can see in this case, so you can see here is the hastration still intact. All right, so it is a normal colon. Now this normal colon is replaced by ulcerative colon. So do you see any hastration? No, we don't see any hastration. And you can see this green area. All right, so this green area is showing what? It is showing the descending colon ulcerative colitis, guys. Now look at here, lead pipe signing. Okay, so lead pipe signing will be abdominal X-ray, will be show you. Okay, and there will be loss of hastration. All right, so there will be loss of hastration in ulcerative colitis. All right, and you can see, you can take the biopsy and you can find the edematous mucosa. So there is an edematous mucosa, and here is the inflamed mucosa. So you can see all the inflamed mucosa and the edematous mucosa and ulcerative colitis. All right, and here you can see the mucosal thickness with the loss of superficial vascular marking. All right, so there is a central area of spotty bleeding. Okay, so spotty bleeding, and the finding are characteristic of the ulcerative colitis. All right, so let me tell you how you can differentiate the ulcerative colitis and the Crohn disease. So there is a mnemonic I'm just using for it, and you can use it. Okay, so if so the mnemonics is that, and the sentence is that if skip the lesion, if skip the length, actually sorry, if skip the length, don't skip the depth. Do you really understand? So if skip the length, okay, if skip the length, if skip the length, don't skip the depth. So what does it mean? It means that in Crohn disease, if you skip the length, okay, if you skip the length, so you are not skipping the depth. Okay, so you're not skipping the depth. So what does it mean that you are transmural inflame the new mucosa, all right, transmural inflame the mucosa, but it is not throughout the length. Okay, so if skip the length, don't skip the depth. Okay, so it is just one mnemonic you need to know. So it is a differentiative diagnosis of ulcerative colitis and Crohn disease. So if you like this video, please subscribe medical student channels and comment down below and thumbs up. Okay, so hope we will upload many more videos about the diagnosis, endocrinology, and other respiratory and other. Okay, so thank you so much. Stay safe.